All right, good morning, Ms. Burton from the National Birth Coalition. We're doing this brief interview, trying to get a sense of our participants in the grassroots grant program. We're really proud of it. It's a main thing that Neighbors for Better Neighborhoods does. And so the more feedback we get about how that goes, the work that it's supporting, the better for us so that we can continue to support great work in our community. So I just have 4 questions for you. The first one, why did you choose a Neighbors for Better Neighborhoods grassroots grant?
Okay, so one thing that I have being in Winston-Salem, Forsyth County, that has really interested me was always seeing Neighbors for Better Neighborhoods in the community. And I got to see NBN grow through the past few years. So I've always had my eye out on NBN and what was going on in the community. So when this year over the pandemic, past couple years, when I saw more movement and more action happening, and I saw the process for NBN and the way that their grants are done, the process looked really easy. to basically you had some really easy options to be able to complete the application. So I think that was one of the second thing. Pretty much the second thing. First one, I was familiar with the organization, what you all do and what you support. But the second thing was not a lot of barriers with the application. And that helped reduce my anxiety a lot, because this is a very first time as a new grassroots organization to even do applications seems so stressful. But I knew that with NBN, I already trusted you and y'all wouldn't lead me in the wrong direction. So that made me really say, I can do this. I can do this. We can do this. So that's what made me decide to come to NBN.
Oh, that's awesome. I'm so glad to hear that. Okay, our second question. What assistance did you receive from NBN that you found particularly helpful or useful in your work?
Okay, so I, of course, am the executive director of the National Birth Coalition. We were established during the pandemic, so it was the height of a lot of babies being born alone in the hospital setting. And for us, particularly as Black and Brown women, we already had a healthcare disparaged situation here for a long time. But as a birth worker in the community, I saw so many other levels just coming up out of this birthing system that has been here for so long. But it was at a critical time where I just said, I can't watch this anymore. So the work in that and assistance that I requested from NBN to receive that I found helpful was that you really listen to the problem of birth workers. You heard our proposal to have more birth workers so that people and birthing people were not going without any support. And at the grassroots level, being able to be heard, that's everything. That's
Yeah.
everything. And when I submitted the proposal, it was for birth work and for advocacy training. So our families will be able to come out and really truly be listened to when we go into the hospitals, learn how to work with healthcare providers and understand what our rights were. And that was basically a lot of things that I found as a birth worker, was that a lot of our rights were being violated. And it didn't matter, Black, Brown, a lot of people really were hurt during the pandemic, but we were hurt a lot worse when it came to our birthing outcomes. So NBN helped us, the National Birth Coalition, be able to create the foundation, grassroots foundational work to be able to get our birth work started from an organizational nonprofit standpoint in a way that no other organization has done or has ever done in Winston-Salem with reproductive justice. So that's what you all helped us with. First time ever.
Yeah, well, that's excellent. I'm glad to hear it. So our third question, what is the National Birth Coalition and why are you passionate about it? I know you touched on this a bit, but yeah, tell us some more.
So again, the National Birth Coalition was birthed out of the pandemic situation, and my particular background is a unique set of expertise. And I say that because I've been a birth worker for 12 years here in Winston-Salem. So I've been able to see the changes in demographics and culture that has been underserved for so long, but also as an opportunity to be able to I guess, use the trust and relationships I had built up over those 12 years
Yeah, for
to
sure.
be able to create a platform and an organization that can help build bridges with the birth work here in the area, in the community. So that's one reason why the National Birth Coalition was created. The second reason the National Birth Coalition was created is because of my other passion, my other love, is food. So
Perfect.
so my background educationally is nutrition and dietetics. And so on my journey to becoming a nutritionist, a nutrition specialist, and eventually a registered dietitian, I had to learn about different food systems, food cultures in a way that as a Black and brown woman, I said, the buck stops here. Okay.
Mhm.
I'm living in a city with 21 food deserts.
Right. Yeah,
This isn't making sense. This is not
exactly.
making sense.
Mhm.
And part of this, again, learning and knowing systems, I went to school and I recently graduated from Oakwood University in Huntsville, Alabama, with my dietetic internship. So coming back home, it was like, this doesn't make any sense. And it's been like this for how long? And where are the people working on this? Yes, we're working on it, but are we working on it in a way to really help the birth disparities, to because this is again one of those nutrition realms that people are, I guess it's taboo to talk about.
Mhm. Yeah,
But and it's also a problem with when people don't have the nourishment in their bodies.
right. Yeah.
And that's just the basic standpoint. It's a human rights thing to be able to have food. And it's it just got to the point where the National Birth Coalition said we've got to bring in food and reproductive health education to our people in another way. So that's the other leg of it. We've got nutrition, reproductive health, and of course, birth justice work that we do. So
Good, good. Yeah, that's great. I think that is, you bring up a good point that those two things are not spoken about or discussed as having a relationship with each other. And so, yeah, that's great. I'm glad that we have an advocate for that, here in Winston-Salem. All right, so our last question, what would you say to someone considering applying for an MBN grassroots grant?
man, and I tell you, Kristen, it's something to be able to make your dreams come true. And it's something when you know that a group of people have their money to be able to help you make those dreams come true. And at a grassroots level, it really touches me that people believed in the nonprofit and the work, because I don't know how many people would, or did or will, but we just got to save our babies and our families, and
Absolutely.
that's what it's about. So people applying, just
Yeah.
do it. If it's your passion, do it, because you've got guidance, and they'll help you. Thank you, MBN.
Thank you so much, Shalonda. Man, this was so much more than I was ready for this morning. So I really appreciate that. Thank you so, so much.
Thank you. Appreciate you all and your help.